right, here we go in three. Here we go in 3, 2, 1. What's up, y'all? Welcome to the Sports Medicine Broadcast, a podcast to promote and improve your practice as an athletic trainer. Today, Kate Miller is back. We're interviewing Dawn Stuckey about pregnancy in athletic training. So Dawn is an athletic trainer. Dawn was working at Rice University when she was pregnant with her twins. She's also a triathlete, so she's got lots of experience from as an AT, before, during, after pregnancy. And then obviously Kate's got lots of expertise in both the sports medicine world and the fitness professional world, dealing with pre and post natal fitness and returning to normal and making modifications and adaptations. So we got some questions from Twitter we'll throw in there as well. If you want to join this conversation, it's sportsmedicinebroadcast.com/pregnancy and athletic training, where I'll post the links, tips, resources, different things like that. But we are also live usually when we do these shows, so check it out on sportsmedicinebroadcast.com/Facebook, and that'll allow you to watch live, join the conversation live on Facebook, and get your questions hopefully answered there. So I am your host, Jeremy Jackson, and this is sportsmedicinebroadcast.com/pregnancy and athletic training. So we're going to start right off with Dawn. Dawn, having worked with college athletics and predominantly female teams, last week we talked about incontinence with Dr. Sarah Duvall, and again, that was smb.com/incontinence if you want to check that one out. We discussed that up to a quarter of females athletes deal with incontinence during athletics or during competition and training. And so I just wanted to get your take or perspective on the female athlete and incontinence, and then we'll kind of continue on into pregnancy and athletic training. So Dawn?
Hi, good morning. I would say that I haven't really had any athletes approach me at the collegiate level about the issue, but that doesn't mean that it's not going on. I would assume that it's kind of an awkward subject for that age range, and they probably don't understand why it's happening if it is. But unfortunately, or fortunate maybe, that nobody has really contacted me or come up to me about that issue at this point.
And then Kate, Dr. Duvall said something about, instead of saying incontinence, what was the other word she said she liked to use? Leakage, right?
Yes, leakage. And so, because technically incontinence, we wildly think of urinary incontinence, but it can happen on both ends. I think more commonly female, especially when we're talking about pregnancy and postpartum, you're going to be talking about the urinary incontinence. And so leakage is typically the more casual word, euphemistic word, I guess you could say, because a lot of people also think of incontinence as, that's just for old people. And it's not. Like we talked about last week, incontinence isn't inevitable with age. It just happens to come with age. And a lot of that is because of habits or ill training of the pelvic floor, et cetera, et cetera.
All right, and so we'll get into some of that as we discuss pregnancy and athletic training, because it is an issue with a pregnant athletic trainer if you're standing on the sidelines, or you're treating somebody and you got to sneeze or something like that. So it's an adaptation that you have to make. So Dawn, we're gonna go ahead and start with you. I know Kate is currently, as we're talking right now, 7.5 months pregnant, and so she's kind of living out everything we're talking about. But Dawn, why don't you tell us your athletic trainer story? So like how long you've been in athletic training, where you were when you were pregnant, so where you were practicing when you were pregnant, and then where are you now?
Okay, great. So I have been practicing for about 16 years now as an athletic trainer. I did the old school internship route and had lots of work hours, that's for sure. And when I was pregnant 4 or 5 years ago, I was at Rice University, and I was working with the women's soccer team. So I was fortunate to have I feel like have female coaches with me, and a really good support staff at athletic training that understood, what I was going through. But the athletes on the team were just amazing. My coaches were amazing to kind of let me, go through the experience. And like you said earlier, I had twins, and so I wasn't really a high risk pregnancy because I was very fortunate, but I did have to be a little bit more careful. And I was due in December, middle of December. And so I went through all of preseason and their season pregnant. big time pregnant too. So August and September were definitely a challenge for me. So I would say that, when I first found out, I waited a little bit longer because I had twins. They say to wait a little longer to make sure everything's going okay. So after the first trimester, I did tell my coaches and my athletic training staff and things like that, just to kind of prepare them for what was to come. And, announce that to your colleagues. And then a little bit later, when I started to show a little more, I announced it to my student athletic trainers and my student athletes. And everyone was pretty excited. I don't know what it is about twins, but everyone just gets a little more, sometimes more excited about that anticipation. So.
All right. And since then, so that was, you said the girls are about to turn 4.
Yes.
What has been your athletic training? How has it shifted since that time?
Oh, right. So I moved over to Houston Methodist Hospital about a year and a half ago. And I'm an athletic trainer for Houston Methodist, and I still work primarily with Rice University. I'm just employed by Houston Methodist. So the one big difference for me is I don't have a sports team now at Rice University. I'm more their medical liaison. So instead of 14 athletic trainers trying to contact all the doctors and schedule appointments and MRIs and communicate with all the team physicians, I'm that kind of in-between person that kind of gets all the work done in between and schedules all those appointments and gets their office notes and things like that. So I'm trying to streamline the process for Rice University and kind of make it a little easier on their lives every day. So it's been a real joy. I would say I don't have to travel anymore. So that's been probably the biggest adjustment for me that I had to make after my girls were born. And that's been a real joy to be home with them. But I'm still able to be around sports every day and do some contract work on the side, obviously with Houston Methodist when they need me. But mainly I'm at Rice University still.
All right, very good. Way to set the background, the tone there. So when I asked this question on social media, Todd Sabo said he wanted to hear just about the daily struggles of working while pregnant and then strategies to make it easier, both mentally and physically. So both Kate and Dawn, I mean, Kate, as you're working through it right now, Dawn, as you've been on both sides of it, as specifically an athletic trainer, you guys just kind of share your stories, and then whenever we're ready to move on, I'll move us forward.
Go ahead, Dawn, you go first.
I think being an athletic trainer, a female athletic trainer, probably one of the hardest things for us in general is just to let other people help us. And we're used to doing everything on our own, or as much as we can. We're slinging coolers up and getting them on the table and setting up practices and, things like that. And so asking for help doesn't come firsthand for me. I'm used to doing a lot of it on my own. And so I knew right away, especially with twins, that I needed to stop doing that and to ask for help. And especially when the months were, the summer months when it got hot in preseason, I had to ask for help. And that was a big thing. And we must do that. And we can't feel guilty asking for help. Once the athletes knew I was pregnant, they were more than willing to help me. Our other athletic training staff was willing to help, and everyone just did as much as they could to make me comfortable. And that made me over time feel less guilty for asking. And, it kind of became the norm after that. But at first, I think that was a struggle to know my boundaries and my limits so I wouldn't hurt myself or the babies. Kate, do you have a similar experience?
Yeah, I'd have to agree. So yeah, I work in physical therapy and I also work in fitness training, group exercise, things like that, post-rehabilitation fitness as well. And that's a huge thing, is asking for help, because we are so used to, one, leading by example, too, showing people what to do, not just telling them what to do. So knowing I'm not going to be able to show you that bounding exercise right now because I need to make sure I keep everything inside of me still. And positional stretches. I mean, things as simple as a hamstring stretch on a football player, a rehabbing football player, is difficult when you have this bulbous middle. So asking for help, getting somebody else maybe to step in for you in certain situations, which is really hard, especially because as athletic trainers, physical therapists, fitness trainers, we're so proud of what we do. So asking somebody to step in and essentially kind of do our job for us is very difficult, but you have to humble yourself because your body is going through so much, and we have so much knowledge of the human body. We know this, but respecting what the body is going through is a very, very difficult thing to kind of allow and to let go of, well, I have to do this myself. I think the modifications, if I know my first pregnancy, as much as I thought I knew about the human body, there were things happening that I just didn't expect. I was doing triathlons. I was running a marathon, ran the rock and roll marathon right before I was pregnant. And my body went through hell. Hyperemesis gravidarum. I ended up being diagnosed with that, which is morning sickness times a billion. And I was not able to exercise. I was on bed rest. I had a lot of other complications, and realizing that I couldn't work, I couldn't help others without helping myself first was really, really hard. And letting go of the fitness and athletic health world for a little while to take care of myself. And not everybody has terrible experiences. Everybody's pregnancy is different. You know what I mean? But really respecting what's going on with your body is going to be number one, because you can't help others if you can't help yourself, as cliche as that sounds.
Yeah, that's absolutely right. Sorry you had such a different journey. I can't imagine. I was really lucky. I didn't have a lot of morning sickness, so I was lucky that way. But and I think that we always, athletic trainers in general, males and females, we and physicians and everyone else, we take care of everyone else so much, and the focus is there that we don't take care of ourselves. And that's just for anything. I have an injury that I've been dealing with forever, and I just put it, you put it off because you have other things to do. And so when you're pregnant, you're right, you can't let those things slip. I think that just self-care is huge when you're pregnant, and you don't realize in the beginning stages that you need to get some good compression socks or some solid shoes, really good fitting pregnant clothes, so that you actually look good and feel good while you're pregnant. That's a big deal when your body's changing so much. I was a big firm believer in that. I'm going to invest in some good clothes so I feel good as well. And then, get a belly belt or something, for a maternity belt, to support you if you are standing up a lot on the field or something like that. But your self-care is definitely going to help you along the way.
All right. So what are some of the adaptations specifically that you've made? You mentioned the belly belt or maternity belt if you're standing up a lot. And then I think either in the pre-show or maybe early in the conversation, Kate had mentioned not being able to demonstrate like an exercise. And so, specifically this morning, I was showing how to use the foam roller for the glutes, right? So what are some of the different adaptations that you used while pregnant to teach to still do your job?
Go ahead, Don.
I think that I had it a little easier because I had so many people in the athletic training room that I could just kind of pull an athlete over and be like, hey, Susie, come over here and show somebody how to do this stretch, or things like that. But, I wasn't able, I just tired easily. And so I had to take more breaks and allow myself that break and let somebody else help me do treatment or the massage that I needed to get done, or, because a lot of times that stretching is pretty daunting when it is a football player or my goalkeeper or soccer player or something like that. So I was fortunate to have some other athletes and student athletic trainers help me, some staff members, things like that. But I think the biggest thing I remember is my student athletes and my coaches got me a chair for preseason, and I sat down during practice. And like I said, it was the hot months. My heart rate was already higher because I had 2 babies in there. And I had to sit down. If I stood up for a long time, I would feel really bad. And so I forced myself to sit down at practice. And, I had a clear view of the entire field. I was lucky because it was soccer. So there wasn't too many drills going on at one time, where at football, it might be a little different. But you're going to have to make those adaptations. My friend Hannah, I talked to a few of my friends last night to kind of get their point of view too. And she was saying during her football season, they turned the air conditioning on in the press box and had her go up there during August and September when she was, really pregnant, and said, well, you're watching practice from there. Come down if we need you. And it was a nice adaptation and respectful for them to do that for her as well.
That's awesome. So when we talk about like pregnancy concerns with exercise, we kind of have to move it over to our fields, both physical therapy and more so in athletic training in a lot of ways. The things that concern us, or the risks about dehydration, of hyperthermia, of hypoglycemia. If we are in an active work environment, those 3 things are not, it jeopardizes the health of us, the baby, and for you, 2 babies. So your body's going into delta time. Your heart rate's going to be much more increased than the average pregnancy. Your cardiac output, your blood volume, all of these things, of course, we think about with exercise, but just standing is considered exercise, especially when you're housing 2 human beings in your belly. I mean, that is a lot of stress. Your heart grows, it changes position. Your body is going under so many changes just at rest. When you have an active lifestyle, you're going to have to make modifications. And it does not mean you're lazy. You're building humans. You're not lazy. People are not going to look at you like you don't belong there. You're not changing as a person at all. You're actually becoming a superhero. I actually agree with that. But there are things like the belly band. There are SI belts. A lot of women have increased pelvic instability. And so the SI joint tends to move around a little bit. You get more low back pain. SI belts can be useful for some people. I don't want anybody to become dependent on the belts. And I really stress that to both my pregnant and postpartum populations. These are not meant to as a crutch. They're just to get you through certain situations or certain times during your pregnancy and postpartum. There are taping strategies. I know athletic trainers, I teach taping courses too, to a lot of athletic trainers. But you guys use tape, all kinds of tape, more so than I think physical therapists use in a lot of ways. There are several taping strategies for your belly, depending on the time, like during your pregnancy, what kind of tape you're going to use. I'd say a dynamic tape is usually better than a rigid tape. So you don't do damage to the muscles. There's different taping strategies depending on how pregnant you are. And also taking a seat. The increased blood volume is going to increase the stress on your kidneys. So again, even when you're standing, your circulation, your heart is going to be under a lot more duress, if you will. Right. And that's why people, they swell, they urinate more, things like that. So give your body a break, have a little respect. I mean, you respect for the athletes that you work with and you take care of them and you put them on a pedestal. It's time to put yourself there too while you're doing your job. Doesn't mean you have to quit or take a break unless medical complications occur. Right. But knock on wood.
All right, so we've talked a good bit about some of the adaptations you made. So either of you, we'll start with Don. List some of the things that the very small things that you felt were really helpful. You already said a chair, and then Kate just mentioned like hypoglycemia. So like having certain snacks with you, and then specifically like this type of snacks that worked for you in those situations, because obviously you can't carry a chocolate covered protein bar out in the sun in August, right? So specifically what was working for you in those situations to help prevent some of those. And then Kate, I know your situation was different than Dawn's, and we'll go over that as well.
I think some of the big things is I had a large water bottle that I made sure I drank all the time. And I was always thirsty. I woke up in the middle of the night and I would just drink, go back to bed, go to the bathroom, wake up, drink. And it was just this big, horrible cycle. I felt like I never slept because I was always drinking water. So they were some thirsty girls. But so I always had a large water bottle to keep track of how much I was drinking. And especially when I was outside in the heat, I did add Gatorade or, electrolyte drink and stuff, but I was more concerned with just the water and trying not to drink sodas and tea. You have to watch out for caffeine. So, I used to drink a caffeinated drink every morning and I stopped that and felt much better actually, but surprise. But, you had to alter that for sure. And I also had snacks. In the first trimester, I don't think you need to have a large intake in calories, but I know in the second and third trimester, you do need to start adding, 300, 400 calories, per baby, I guess. And so I had the luxury, I could eat a little bit more, but I was eating, cheese sticks and peanuts and things like that where they tasted good to me still. You have to find what tastes good, I think, too. And some things that just you love, you just don't love anymore. They just don't sound good at all, especially when you're swollen and bloated and things like that. So that was the big thing for me, is just having some things that I enjoyed. I like fruit, and so I did bananas and apples a lot too. Things like that were just simple. What about you, Kate?
That's so my story is a little different. I had hyperemesis gravidarum, and we won't really go into that, but it is a clinical diagnosis of malnutrition extreme vomiting, extreme dehydration. Most cases get IVs. There are a lot of women. I was lucky enough, I had no hospital stays or anything like that. Some women end up bed rest their entire pregnancy. But the biggest thing is the malnutrition and the aversions. So you were just mentioning, you know, what still sounds good to you. I still can't eat eggs right now. But you're going to have to find something that you enjoy, and it's going to be trial and error in a lot of ways, because this pregnancy is even different than my first pregnancy. And my pregnancy is going to be different from your pregnancy, but your taste buds do change. That's one of the side effects of being pregnant. Your taste buds kind of evolve, and sometimes they never go back. I may never like eggs again, who knows? But I did a lot of smoothies, but I made sure to watch the sugar, because you do have to watch out for things like gestational diabetes, which, you know, a lot of people have a genetic predisposition to, but you still, I mean, some people think that when you're pregnant, it's a free for all to eat whatever you want. And you are absolutely correct. The normal weight gain for first trimester is 0 to 3 pounds, up to 0 to 5 pounds. It depends on the person, how tall you are, you know, your activity level, et cetera. But it is completely normal not to gain weight your first trimester. And about 40% of the population don't know when they are pregnant in the first trimester. Especially a lot of athletes who may be experiencing amenorrhea from low body fat or something like that. They may not recognize a missed period, which is something we can talk about if you'd like. But I'd say I did frozen grapes a lot, food with a lot of water in it, because dehydration is huge, especially if you're out on the field, you know, during a game or during a practice or something like that. If you have a diagnosis of hyperemesis gravidarum, you might not be able to drink water. And so having any kind of a liquid diet with electrolytes in it, shakes, frozen grapes saved my life, frozen watermelon, things that keep not only your body cool, but hydrate you and feed you at the same time, I think is a huge thing, especially maybe you don't have HG, hyperemesis, but you are feeling that morning sickness, but you don't want to call in sick to the game or to the job or, you know, whatever. If you have a cooler, are you guys allowed to have like cooler packs at all? I mean, I work in physical therapy, so I you know, pardon my ignorance, but are you guys allowed to have coolers for yourselves?
Yeah, I would think anybody would pretty much, as a pregnant lady, you can get away with pretty much anything. So, so you can take I'm sure you can take a little snack cooler or something, put it on the sideline at a football game or, you know, in the locker room or whatever. Yeah, definitely.
Perfect. Propel, Gatorade. Yeah. I know they're kind of high sugar and you kind of think of that as like an athletic drink, but you're going to need it because you're going to need more water. You're going to need more sugars, especially if you are not eating as much. The frozen fruit and the shakes, I can't say enough. That really helps. And it helps to keep you cool as well.
Right. I did shakes too. Yeah. In the morning for sure. Yeah,
definitely. And morning sickness, contrary to popular belief, is not just in the morning. Mine was mostly at night, although I was throwing up 30 to 50 times a day. Mine was mostly at night, not the morning. Go figure. So just be prepared at all times. I had snacks, little peanut butter cups or something that I could just take little bites of in the car. Here in California, in Temecula, it gets quite hot. It was 120 when I was pregnant. So just trying to keep cool. That large water bottle idea is a fantastic idea because it helps you keep track of how much you're drinking. But I can't imagine with twins. The guidelines are a little bit different for twins.
They are.
How much you're eating, how much you're drinking.
Yes.
And it's funny to find a balance. You were talking about drinking water and going to the bathroom, drinking water and going to the bathroom. I thought that was horrible enough with one. I can't imagine building two. But listen to your body. I think that's the biggest thing. And then your heart rate, keeping cool is going to help your heart rate stay a little bit lower as well. So does that answer your question, Jeremy?
Yeah.
Yep. I think there's lots of good snacks. And one of the biggest things that you said that I like is that you got to find what works for you. Because as athletic trainers, you know, we can easily get, okay, well, you need to do this, and this to make this better. But everybody's situation is different. You still can't eat eggs. Sarah, my wife, still has trouble 4 years later eating like a banana sometimes because when she was pregnant, she had that aversion. And so it really is, it's important to continue to try different things, find things that work, plan ahead, prepare, have that cooler on the sidelines, like you were saying. And so obviously I've never been pregnant, but we have 3 children, so I've kind of been through this.
Right.
And again, we're talking to experts here. So what would be your one big piece of advice for the pregnancy? So we're not talking about the birth or afterwards yet. So that for during the pregnancy as an athletic trainer, what would be your one big piece of advice?
Kate, you got anything?
Oof. I mean, so I'm a nerd. I would say knowledge is power.
Yeah.
Ask questions, talk to your doctor, talk to other professionals. I talked to several athletic trainers when I was in certain situations, and I worked in physical therapy. I talked to MDs, I talked to DOs, things that I didn't know. I talked to Dr. Duval, who is now, I mean, she's so smart, just so smart. And I educated myself so that I could better educate others as well, and that I could take care of others. So I think if you are not very familiar with some of these things, or you find yourself pregnant and you're like, oh my gosh, I know nothing about what's happening, educate yourself or go to a seminar, take a course, take a CEU course, talk to a professional, get to know what the best things and best options are for your body, because each person's different. You're not going to be able to follow an A to Z book on how to deal with your pregnancy.
Yeah, absolutely. And I think just our 2 examples are so different in the experiences that we've had. And hopefully you're having a much better experience this time around with your pregnancy. And it's just different. And, well, even, 2 or 3 different pregnancies, though, can lead to different things. And
Yes.
I would say that is a huge thing, is have a support system and learn and understand, because none of us know what to expect or what to do. We learn as we go. But also have grace and patience for yourself and your husband and your family, because your husband, I'm sure Jeremy can talk about this. He has no idea what you're going through either. And so, the mood swings and the fatigue and the morning sickness and all that, he's trying to help you, and he's just trying to get through it too. So I would say be graceful, gracious for yourself and your family, because I had days I wanted to cry. There was days I was just loving pregnancy. And then my friend had a horrible pregnancy, just kind of like your situation. That first one was kind of a nightmare, just bedridden and stuff. I can't imagine that. And then, there's people that you don't even, they're just so cheery. You can't imagine. They're just having an amazing pregnancy. So I would just say, be patient and know that things are going to be different as the trimesters go along as well. So it's going to be a learning experience, because the first trimester with that morning sickness or whatever is not going to be anything like the second or even the third. When you're in the last month or so, it's completely different. You're slow and you're huge and you just feel awful and you can't wait for this to be over.
I just entered 3rd trimester. I understand.
Right. You're so excited, but you're just ready for it to be done. And, there's just different things. I could barely eat anything in my 3rd trimester, especially in the last month, because I had twins. So I think I was eating like this much food at once, because I just didn't have any room in my stomach.
No space.
Yeah, there's no space. And so I was just a grazer all day long, which I was okay with, I guess. But it's just different experience as you go along, for sure.
I'm gonna tag on something there real quick, Jeremy, before we move on. So listening to your body and listening to any medical precautions.
Yeah.
You wouldn't put your athlete in a situation that could put them in harm. I mean, I would hope not. I hate to say think of pregnancy as an injury, because I really don't want that to get out there, but your body is going through so many changes. You're going to have to think about the risks. For instance, I have placenta previa now too. So I'm not supposed to do certain exercises. I'm on pelvic rest. I have, and that kills me, because I want to be on my spin bike. I want to be running outside. I want to do things with the athletic population that I might work with, or my patients or whatever, but I can't, because I risk hemorrhage. So if your doctor says, and they'll always err on the side of caution. They have to, and which is a smart thing. But if they say, hey, this is a condition that can put you and your baby at risk, listen to them. There are ways. I still exercise. I'm in great shape, but you have to work around the precautions and respect what's going on with your body, the changes, just as if you would respect something going on with your athlete.
Yeah, that's a great point. That's absolutely right. I was limited to, I wasn't supposed to get my heart rate over 140. And I mean, I could, in the heat in the summer, I could walk 5 feet and then I would be at 140. I'm like, all right, now what? So I couldn't exercise past like 10 weeks. And that was really hard for me being, Yeah, because I would walk jog and
Oh.
I would jog for like 2 or 3 minutes, and then it would take me like 8 minutes to get my heart rate back down to where it was normal. And I'm like, this is just stupid. So I would just walk, and so that was a really big adjustment for me. And I just had to, and I wasn't I mean, I was watching what I ate, but I wasn't, paranoid about it. But I wanted to make sure I wasn't, just eating free for all, like you said before, because I couldn't exercise. And I think I did a pretty good job.
So I'm going to jump in here. There is a story that I've told multiple times. Sarah, after our first child was born, she was sitting in the room, which is literally 3 feet from the kitchen. She was nursing our son, and I was washing dishes. She was mad at me washing dishes because I wasn't sitting there with her at her feet while she was nursing our child. So you mentioned like the emotions, like some days you're super happy, some days you're super just crazy, depressed, sad, whatever it is. And so obviously I wasn't personally experiencing those, but I was feeling the effects of that stuff. And it wasn't her fault. Like she just, all the hormones and emotions and everything that's going on, the frustrations, everything was new. And so whenever I talk to dads or, expecting dads, I'm like, look, if at all possible, take a month off, take 2 months off, whatever, take as much time as you can possibly take off and be completely away from work and be completely absorbed in the home life if you can possibly do it, because
Absolutely.
everything changes. Everything changes. And so there's 2 things I want to mention. One is we did a podcast a while back with Alex Ager, and they actually had FMLA, like his coworker was going to be pregnant, and so they did all the paperwork and stuff up front, and they had a substitute athletic trainer basically, which is really hard to do because there's just not a whole lot, and then there's also a lot of steps. There's not just a lot of athletic trainers sitting around doing nothing, but it is possible. So that podcast, if you're wanting to check it out, at sportsmedicinebroadcast.com/FMLA. So that's for the maternity, paternity leave stuff. So if you want to check out that, if you're expecting to be pregnant or you have a coworker that's pregnant or expecting to be pregnant, then do the work up front and hopefully make it easier for you. And then somebody contacted me via social media, and it was anonymous. They didn't want to completely describe their situation, but I'm going to read this here, and then we're going to kind of talk about the transition from like birth into the afterwards of being an athletic trainer. So this guy tells a story of taking paternity leave for his infant son who was born prematurely, and he was at a position for a number of years, had great support and relationships. While on paternity leave, however, one of the coaches asked about who would be traveling with the team for an upcoming game. When he told the coach that his supervisor was working on that, the coach responded that the AT and the AT staff were making this hard on everyone else. This individual felt hurt and offended by this remark. His years of caring for athletes, putting in hundreds of hours of and working over the holidays seemed to count for nothing because of the inconvenience caused by him taking time for his own family. He's now concerned about how this will affect his relationship when he returns. Okay, so Dawn,
Wow.
being on maternity leave, returning to work, you got those teams counting on you, that kind of thing. So talk about your situation, like basically from the birth and moving forward as an athletic trainer.
I actually had this in my notes to talk about anyways. In that last trimester and afterwards, even in the last trimester, you have to plan not to travel at some point, right? And when I was with soccer, I got on planes and traveled for 4 days at a time. And at some point you have to say, it's not safe for me and my baby to travel anymore because I don't want to have a baby on a plane. So, at that point we had to make an adjustment and say, this other athletic trainer is going to step in for me and take over. And she did the last 3 weeks of the season for me, which relieved me tremendously, and my husband, I think, and my doctor as well. And just, it gave us some, I guess, peace of mind that, I was safe at home. And then afterwards, I took a longer leave of absence. I took 3 months off. And my husband took about, he was a coach at the time. And so he had the 3 or 4 weeks of Christmas vacation because he was a coach. And so that helped tremendously. And it's hard because we're trained to serve and to help everyone else. And I can understand what this gentleman's going through, and it's not fair because those coaches have babies at home too and have families. but a lot of times the men don't have to be there as much, or they may not want to, or they're putting their career, ahead, when they deserve just as much time with that baby and that family as possible. I was lucky that, I didn't work at all when I was on maternity leave. I turned it off and I was a mom, and I didn't worry about it. And I had no threat of losing my job or anything like that, because we planned ahead, and everyone at my work was very gracious and understanding about it. But there's guilt, even when I came back from my out of my leave and went back to work, it was still a huge adjustment for me. I wasn't working as much at first. I was doing half days for a little bit to get adjusted. And it was still guilty then, being away from my babies and then not filling my role at the school. So I don't know. Kate, what do you think? It's a hard thing to fill, and it's not fair for anyone to put that guilt on you. And I think family always comes first, and you just gotta make it
always
work.
Comes first. And
it's just another job. I'm sorry.
And, I would hope that coach or that person that spoke to the athletic trainer like that was having a bad day, and took it out the wrong way, or was trying to be a man and, just tough. Try to make a joke of it, tough guy, which is unfortunate, but that's a lot of pressure put on guys, whether they want to be home or not. There's pressure to be the man that makes the money and the man that works, and the woman's going to take care of the family. In the real world, especially nowadays, that's not how it works. And unfortunately, some people have a harder time letting that go than others. That coach maybe had some pressure coming from the top too. I mean, I'm trying to think positive of that situation, but either way, that's completely inappropriate to put stress on an athletic trainer like that, because the fact that you love your family has no bearing on how much you love and respect your job. There Absolutely. Are two different worlds, and finding the balance has been the hardest part. Quick nip. I never thought I wanted to be a stay-at-home mom. I wanted to have my baby, excuse me for the bluntness, pop it out, put it in daycare, come back and raise the kid on my own time. And I had my daughter, and I treat very part-time. I do more admin work right now, especially with my complicated pregnancy and then postpartum. I was forced to. But I'd say each person's situation, I keep saying this, but it's going to be different. If you are a person, or a father especially, that is going to go back to work and you want to spend time with your family, stand your ground. Times are changing. You're going to have a lot more backup as a father for time off and things like that. And try not to take it personally if somebody talks to you like that, especially if it's one statement. But if it's continual, if you're getting pressure from your job, it's time to assess two things. One, is this job going to be appropriate for you? And are they going to respect your family from here on out? Because if they're not respecting your family time now, are they going to respect it 2 years from now, or 3 years from now, or 4 years from now, when you want to go to your child's soccer game or something like that? And then two, is it the right type of job for you right now? Do you need to find a different type of athletic training job while your kids are younger? Does your wife need you more? Really assess what your needs are. And it has no bearing on how much you love your job. Okay. It is an extremely difficult decision for both a man and a woman, the mother and the father, or the mother and the mother, whatever the case is. But really look inside and figure out what's going to be the best thing for you, and take the steps to make changes if necessary.
Yeah, and I think I was talking to my friend last night about this subject, and we were interested in the statistics of how many female athletic trainers and physical therapists, change job settings, especially athletic trainers, when we've always put our job first. When I was single, I went and I just athletic training was it. I worked and worked and worked, and it was what we did, and that's it. And then I got married, and then I was like, well, I don't want to work quite as much, but we're still going to suck it up and do it. And then you have kids, and then you're like, holy cow, my world just changed. Like, mind blown. People will tell you, and then you're like, yeah, it's not going to be like, yeah, it's different. It's so different. It's so different. And it can
She's
be
my
different
everything.
and it can be different for the males too. It doesn't mean that it's just the females. But, I wanted to, I had that guilt at work when I came back, because I had to leave at 5:30 to go pick up my kids, because my husband was a football coach and he was there till 10, and I had to go get my kids. So somebody else was doing my job at Rice University when I left, and there was guilt because I didn't want that to happen. And so everyone was really gracious and helpful, but I didn't want, that feeling on me anymore, and that burden on them. So Houston Methodist was a perfect fit for me now, where I don't have to travel, and I can, have a little better hours and things. And so I think the statistics are just overwhelming. And mad props to my friend Tana that I was talking to last night, because she makes it work. Her little boy sometimes goes to football games with her, and the parents in the stands will hold him and play with him while she's working. If there's not very often, but sometimes that works. Or her daughter Marley, somebody picks her up and takes her to swim lessons, a friend that has a kid in swim lessons. So she makes it work, and you have to have that support system too. Otherwise, it's going to be really daunting and stressful on you and your family. So I would say have a good support system too.
Yes, absolutely. That's why we're still here in California. we don't necessarily want to live here anymore. We'd like to go elsewhere, but his family's here, my family's here.
Yep.
I'm still I have to work because I live in California, but there's that. But that's a great point. Having a support system of any kind, whether it be friends, family, coworkers, it's really important to have a very supportive work environment. So for that person who is going, maybe they're still going through this. I don't know if this is a current situation or a was situation, but
right.
I would really do a full evaluation of your place of employment, and maybe even have a talk with this person. Maybe this person, like I said, had a bad day. Sit down and talk to the person. Yeah. I'm trying to think of the positive side, but sit down and think about what your options are. Investigate what your options are. And you and I, we both made changes for our families, but that doesn't necessarily have to happen. So.
Right. And scheduling too. I think, as Jeremy, you can probably relate to this with your staff member. If you have 2 or 3 staff members on board, and one of you has a family and 2 don't, there's maybe let the staff member with the children have Halloween off, and she works an extra shift here or whatever. I don't
Great
ever,
point.
I feel bad when the single people get punished, like they're like, oh, well, you don't have a family, so you can work, more tonight. No, that's not exactly the right way to do it, obviously. But, give and take relationship. Well, if you guys can let me have Halloween off, I'll pull, the 6 a.m. tomorrow morning. Yeah. Or New Year's or whatever.
We'll be going out late.
So, understand and communicate with your staff members, and especially ones that don't have family, because they're going to want to do things, and have a life too, but they're different priorities. And so I think you have to give and take, but don't just put all of it on them for, oh, you don't have kids, so you can work this extra shift or whatever. So you got to make up for it in the long run, or bring them cookies or something. I don't know.
One of the questions I know I saw was, I think it was Whitney Catalano, but I think it was more than one person had mentioned that. Talk specifically about how you have worked around those schedules. I know, Dawn, you said sometimes you just had to leave. You just, all right, I'm leaving at 5:30, pick up my kids, right? And so you communicate those beforehand. But and you mentioned, I think you said Tana, who was watching live, and some other people, they've brought kids to games. I've done that as well. All right, well, come on, you're coming with me to the game, that kind of thing. So talk a little bit more about your experience after giving birth and returning to work, how you kind of manage some of those schedules, some of the details about finding childcare and things like that.
Kate, you want to go first?
Prime example. My husband is staying home this morning. He's downstairs with my toddler right now, so that I can do this. I can't say it enough, where it sounds like we're kind of preaching, Don, but have a support system. If you don't have family nearby, or if you're military and you're an athletic trainer, I've seen that a lot, actually. Yeah. Have some sort of schedule. Someone that can maybe watch, or if you have a very understanding work environment, that's good to recognize and see about as well. I would just say, one, you're going to have to prioritize. There are going to be certain situations where I can call my mom and be like, hey, listen, I just got to drop Piper off. Piper's my daughter, for a few hours. I have got to do this conference call. This is very important to me. And there have been times where I have called my supervisor. I'm like, I just can't do this today. My daughter is sick. I'm sorry. This is a priority. And they're completely understanding. Honesty is the best policy, I think. but really prioritizing. Sometimes it's okay to let your daughter go to son go to daycare. It's okay. That's not going to ruin them. I feel like you're condemned if you do, and you're condemned if you don't in this day and age. But prioritize, what really needs your attention, and then kind of work from there.
Yeah, absolutely. And I think in the first year is the hardest. My girls went to daycare. And so I had 2 infant daughters. After 3 months, they go to daycare and they're around all these other babies, and there's just sickness flying around that room.
Sick.
And so they never got, I don't know if this is a blessing or not. They were barely ever sick at the same time. Usually one would get sick, and then the next week the other one would get sick. So it would probably be worse if they were both sick at the same time. So I would stay home for a few days, because you can't take a baby to daycare when they have a fever or, at certain points. And so then I'd miss 2 days of work, and I'd get through the weekend, and then Monday would come around and we'd be fine. And Tuesday, daycare called. Got to go get the other one. And I'd go home again, and I had no choice. My husband didn't really have as much opportunity to take off work as I did, especially during the football season. So I had to be that person. And, my mother-in-law lives an hour away, so she helped a little bit, but there wasn't a lot of other people that I could lean on. And I just had to stay home. And so I think during that first year, like, my coworkers just knew that I was a zombie walking around, and I had to leave sometimes. And they really pulled for me and just had a big support for me. And I just can't imagine doing it without them. And I know that some of them were young and they were really annoyed with me, but it's just nothing I could do. Like you said, priority for sure. And I took them to games. Sometimes they were sick, but they weren't sick enough to be, just quarantined.
Just the nose.
Yeah. And so you're just like, whatever. So we'll take them to school. And my athletes loved being around my daughters. And so I did bring them in the athletic training room. And the first time my daughter picked up a basketball, I was like in tears, because that's what I did in college. And so I was like, yes, we got her. I hooked her. So, she was 2. But, so.
That counts.
So, yeah, it does count. So I think that having them around that setting too is great, because you'll have other people want to see your girls grow up and experience it too. So you just got to make it work there. But you're right, priority. Sometimes you just can't help it. You have to go home.
Mm-hmm.
There was a question on Twitter from, I think it used to be AT Voices, but now I think it says AT something. And it was about about people timing their pregnancies or their births around certain seasons. Dawn, have you experienced, was that like a thought at all, like, hey, let's try and get pregnant so that I can give birth this time and be absent at this time?
It wasn't really a plan for me, but it worked out the same. I was pregnant in December, or I had my babies in December, but it was a couple of weeks before our break. And so I still had to use my time off after we were really gone for the Christmas holiday. So it was kind of a bummer for me, but it was still less burden on my athletic training family to pick it up. But if you can plan it, heck yeah, do it where we're in the slow season, and April, May, June, July, have your babies then if you can, because that's better for everyone, and you won't have that burden quite as quickly, and you won't be rushed to come back as quickly, and you don't have to pay for daycare as soon. So
yeah, that is a good thing, because our first son was born in July 30th. August 1st, I think, was when I went back to work. So he was born on a Friday. I went back to work on a Monday, because nobody told me, hey, take that time off. Right. And it was the first week, so we were only going like half days, that kind of thing. But nobody told me, hey, take that time off. Because I was like, well, it's the start of the year. I need to get things moving. I need to get things going.
Right.
I wish somebody said something. Our second son was born July 1st, so I had a whole month off. By the time we had our third son, I said, hey, once we have the third son, I'm going to be gone because he was born mid-November. I was like, I'm going to be gone until Thanksgiving break, and then between Thanksgiving and Christmas, I'm only coming in half a day, right? So I had those days, and I was like, I don't care. Like, I'm going to use those days. I'm going to be there for my family. 3 kids is really tough with, I think at that point, all 3 of them were home because none of them were in school yet. And so, yeah, I was like, I have got to be there for my wife, for my family. And so it took me to the 3rd kid to really learn that. And so if one man listening to this gets a message from me, it's take that time off. Your job's still going to be there. If not, find a different one.
Right.
Find a different one. There's always going to be another set of athletes. There's always going to be another game. Always. There's never going to be another first day, first week, first month, first year of your child's life. Never.
Yep.
Take that time.
And Yeah, and guess what? The soccer athletes that travel with a different athletic trainer, they did just fine. And the 3 months I was gone, everything was fine. They called me twice, maybe. They didn't need me. Boo! I don't. They didn't need me, but it was just fine. And I came back and we picked up right where we left off, and things are that way. It's just I hate to say that, but it's just a job. Your family has to come first. And guys, it's hard because you're going to come home from working 8 or 9 hours a day, or if you're a coach or whatever, you're going to work a long day, and you have to come home. And Jeremy, this, you have to turn it into dad mode right away. Like, you can't just come home and be like, I'm going to go watch TV for an hour and then I'll start being a dad. You have to turn it on right away. And, you have to understand that I was ready for just to talk to somebody when my husband got home. I'm like, hello, I've been home with these 2 screaming kids watching, reruns all day long and, doing this. I need somebody to talk to, and I need you to take my babies and give me half an hour, give me some time to myself for a second. So, the man has to come home and just immediately turn it on and be supportive and just listen to what your wife needs at that point, because it's going to be different every day. Some days I just needed him to sit next to me. Some days I needed him to take my babies. So
be patient. Yep.
All right, we're kind of running short on time here, and so we'll see if we can get to this, or it may be something that we have to come back and visit. But my sister-in-law had diastasis recti. I'm not exactly sure how to say it, right? And so returning to being physically fit, being active, being healthy was a big challenge. Dawn, you are a triathlete, and I believe in Ironman. Correct? You've done the Ironman?
Yes.
Yeah.
Yep.
And so that's 127 miles, is that right? Like, you swim a mile, you run 26 and ride 100?
Don't shortchange it. It's 140.6 miles.
140.6.
So,
Yes.
Okay.
Yeah, you have 17 hours to complete an Ironman. So
yeah,
because if you complete it, you still have to complete it under a certain time to be
an Ironman.
An Ironman. Yeah.
Yep, you got it.
All right. So obviously, you got 4-year-old girls. You were able to get back into fitness, and you mentioned like the clothes were important and shoes. The feeling good was important to you, and kind of returning those things to normal and returning like your brain function. And so let's talk about just returning to activity and not quite yet returning to peak physical fitness level. So just returning to activity. Kate, this is kind of where I think you're going to really have the expertise here in just returning women to activity postpartum.
So let's go. I know you said we're running short of time, and I'm more than happy to jump back on here on another day if you'd like to go over any of the physiological stuff with pregnancy and exercise and athletes, etc. Diastasis recti, diastases, I've heard it both ways. So you're not correct, or you're not incorrect, excuse me. But a clinical diastasis is measured 2.7 centimeters or greater separation of the linea alba, which is like a connective collagen tissue made by the aponeurosis between the transverse abdominis, internal and external obliques. Okay, it's like the line that splits your six pack. Think of it that way, simply. So pregnant women, almost 100% have a diastasis at some point, but that does not mean that they have a clinical diastasis recti. Does that make sense?
Mm-hmm.
So at some point, our body is made to separate. It's okay to have separation during pregnancy. It's, as you were saying, when that separation does not come back together, postpartum especially, where it poses a problem, because there's a disconnection between your core, and a diastasis recti can happen anytime, anywhere between your umbilicus all the way down to, your xiphoid process all the way down to umbilicus or below. The most common site is umbilicus or just below it, kind of like your lower abs, if you will, but it can happen above. If you have a diastasis, it is incredibly important to work with, I'm going to say physical therapists, because I know that there are more pelvic and postpartum physical therapists that deal with this, I think more than an athletic trainer would as a specialty, but correct me if I'm wrong. I'm not aware of like an athletic trainer in a clinic setting that would kind of work one-on-one in that situation. Doesn't mean you can't do exercises and whatnot to bring it back together with your athletes. Let me just say that right there. But you don't want to put too much anterior pressure on a wall that's already separated. So burpees, big no-no. There are taping strategies that you can you can utilize. It is very important to get your breathing canister in line. And Dr. Duvall talks about that in her PCES course, which would be huge for situations like this to take. Making that connection with your diaphragmatic breathing, your diaphragm and your pelvic floor, not doing too much too soon is, I think, going to be the hardest thing for an athletic trainer and an athlete, because you might feel fantastic. Bless you if you feel fantastic after giving birth, but you're going to want to go back as soon as possible, especially if you have a good schedule, good support system. You need to work yourself along a gradient. Your body just went through 9 months of being basically torn apart in more ways than one. Your heart was turned to the left. Your intestines were separate. Your muscles were literally pulled apart. They need time to come back together. Think of it as retraining. You essentially have to retrain your body as a whole. Your posture is going to be different. You're going to have excessive lordosis. There are so many components to postpartum training that are just missed. So really take into account all of the changes that happen to your body and think of it as an exercise program. Maybe that might be the best thing for an athletic trainer, because that's what you guys are experts in doing, is developing exercise programs and whatnot for your athletes, right? Think of it as retraining your body as a whole, making that connection, correcting your kinetic chain. Your hips are to be a little bit wider. Your Q angle might be different, which puts you at a higher risk for an ACL injury. I mean, there are so many different components to think about. It's hard to pinpoint just one.
Yeah, absolutely. And you're going to feel, I felt kind of loose, like my hips felt looser because they stretched, and I had a C-section. And so I had to watch my abdominal muscles, really closely. And I didn't have that priority right away because I was busy with twins. And so 4 or 5 months into it, I did start walking and doing more Pilates and yoga, not as much yoga because I was already stretched enough, but just getting things firing in the right ways. And I was almost doing rehab exercises because I didn't want to leave the house very much. So I was doing body weight squats and band exercises and things like that, and just getting my core stabilized and normal muscle firing exercises, and learning how to stand well again, because you're all hunched over a little bit and you're different when you're standing pregnant with 40 or 50 pounds, 30 pounds more. So
and your center of gravity is different. Yeah. I mean, everything.
So bringing that, your shoulders back again and learning how to stand correctly with your posture and your core firing and things like that. So, and baby steps. Yeah.
Think of functional movement training. Assess your own body, assess your squat, look in the mirror. I mean, you are experts in body movement. Think about that. Now use yourself as an athlete, just a very low level athlete right after pregnancy. And you were talking about stretching. You can still feel like you're getting a stretch in the muscle, right? But your joints, oh my goodness, the relaxin is really prevalent, especially second and third trimesters. So you are loosey goosey. That does not snap back right away. You still have relaxin coursing through your system. Your joints still have that laxity. Your muscles could be tight, but your joints could have the laxity. So there's, it doesn't mean you should go do yoga necessarily, just because you might feel tight in a certain way. But again, I keep going back to knowledge is power. Learn about the changes that your body's going through so that you can adapt appropriately. Especially because each situation, your situation was very different than mine. I mean, we both had C-sections, but the recovery, I guarantee, was different.
Yeah.
So I do have a question. I think it was Alana asked on Twitter, and then I noticed this with Sarah, my wife, and then actually Dr. Duvall mentioned this, that the BOC didn't approve a course because it talked about this. You both said from feeding. So breastfeeding, like Sarah, my wife, found that she had to physically relax and pull her shoulders back because you're here all day. Your baby's in front of you, your arms are hunched forward, and feeding that or burping, either way, you're always forward. So talk just a little bit about your experience with retraining that posture, like you just said, and opening up your shoulders, and how important that is even in the early stages, the first days and weeks and things like that.
So they don't call the immediate postpartum 4th trimester for no reason. That baby is attached to you still, and skin to skin is so important. So for the next, even I'd say 2 to 6 weeks, usually you're on some sort of maternity leave, that baby is right here. So you are, the easiest way to put it is you have upper cross 24/7. You are internally rotated, kyphotic, forward head, feeding the baby. You have to take countermeasures. And at the same time, be careful because you don't want to stretch or put stress on the anterior portion of your body. So I'm not going to be doing a lot of overhead stretches or extreme rolling on the foam roll, even though that would be my first go-to, because especially with C-section, you understand, Dawn, you cannot stretch that because the scarring has to heal on so many levels from the uterus all the way to the epidermis. So stretching that is not a good idea. But doing things like snow angels on a wall, there are a lot of athletic trainers, athletes, physical therapists that are going to hate starting from the ground up. It's going to feel, and this is maybe not for everybody, but it felt like it to me, that I was a beginner at everything.
Yep.
No weights for the first few weeks, range of motion. I mean, I couldn't go my full 180 or more. I was stuck here because of my poor posture. Doing things from the ground up all over again is going to be very, very important. So breathing, posture exercises, and standing, I would say before you do anything supine to stretch, you don't want to stretch the anterior of the body. And talk to a professional. If you're not sure, if you're like, oh man, I just don't know. Talk to a physical therapist or talk to a different athletic trainer who maybe has more of a specialty. Don't feel bad about asking questions or take a course. Learn. If you have to go back to basics and you're just not sure what's safe to start with, talk to somebody else, look it up, take a course.
Yep.
Done. You just agreed.
Yep.
Check.
I think the other big thing is just remember that your body's not going to be the same after pregnancy, right? So you're going to have a big adjustment that it may never look the same after pregnancy. And that's okay because you just gave your family and you, the Lord just gave you an amazing gift.
Mm-hmm.
So don't be so worried about, losing the weight and looking like you were before. If you have a gene size bigger, let that gradually happen the safe way and be strong about it and be smart, because you need to, continue to eat more calories as you're breastfeeding too, and more water so you can have good breast milk and things like that. And so you still have to take care of your body afterwards, and don't be focused on losing weight right away. Obviously eat healthy and do good things, but don't just get it in your mind that you're going to return right back to the size that you were, because it may be different. Those genes may never fit the same.
Start at the bony structure.
Yeah.
I mean, it might not be adipose tissue.
Right.
Your bones your hips are set differently now.
Wider. Yep.
Don't be hard on yourself, especially if you gave birth vaginally. Yeah. I mean, my hips got wider and I had a C-section and they never went back. I was a 0-2. I am a 4-6, honey, and I'm never going back. It is what it is. Yep. But start at the bony structure. I mean, don't go crazy dieting. You really have to be easy on yourself. And men, your wife's bodies they may not be the same. I imagine you're with your wife because you love her, so you're not going to be hard on her, but just really realize that might not be the same person physically, mentally that you married, but you still love that person. Be easy on her, compliment her. I know that sounds maybe silly, but it makes a difference.
Absolutely.
And on that same reciprocal, women, if your man tells you that he likes your body the way it is, that he still wants you, then that's what he means. Because there's Sarah, we had this conversation, a couple of times a year. It's like, oh, my body's just not the same. You're right. But I want you. Like, I desire you. I want to be with you. I want you. I want you to put on a bathing suit. I want to be seen with you. I want you. And I say that to her because I mean it. And sometimes, it's hard for her to deal with that. So men, tell your wives, tell your, if you're not married, tell your baby mama that you desire her. Women, listen and accept that. Right? Because one of the big things that I know is a struggle, we talked with Christy Keeler a while back about her postpartum depression, and it's been a battle for her since her last one was born. So it's the very last thing I want to end with. That's sportsmedicinebroadcast.com/depression. right? And it is something that is very real. It is something that is very real. The part of the issue that where I talked about earlier, where Sarah was mad at me because I was washing dishes, had to do with the chemical changes in her body. And so when after pregnancy, your body changes, everything changes. There's chemicals, the hormones, everything changes. Be willing to open up, to talk, to ask questions, just like they've said throughout this whole podcast. And know, like, you can listen to sportsmedicinebroadcast.com/depression. And Christy is always willing to share her story, to reach out, to talk, to encourage, to point you to resources. But Dawn, Kate, any final thoughts on the postpartum depression and before we close it out here?
Yeah, quick tidbit. So estrogen, progesterone, all these hormones raging, and I mean raging through your body. Just a stat for you, a pregnant woman, they have more estrogen during those 9 months than a woman who's never been pregnant in their entire lifetime. Think about that. So that the amount of estrogen in a woman's lifetime who does not get pregnant is less than someone who is pregnant, that estrogen level. And that's just one of the many hormones. That doesn't go away right away. And for someone who has like a serotonin reuptake issue already, or a predisposition to depression, who cannot take certain medications when you're pregnant or postpartum breastfeeding, it is going to be especially difficult. Do not be afraid to talk to somebody, whether that be your doctor, whether that be, I would urge along the line of a professional, especially if you are having a disconnect from your baby or from your husband or yourself. It is extremely important to realize it is normal to feel these things, but that doesn't mean that you have to live like that. In a lot of cases, it can go away in a few weeks. Your hormones can start to balance out and you can feel better. But in a lot of cases, it doesn't. Your brain actually changes wiring when you become a mother, and it doesn't go back. And we didn't get into that at all today, but you do rewire your brain when you're pregnant and become a mother. And sometimes there are people that have a little bit more of a difficult time adjusting with that. And that's okay. That's okay. Talk to someone, anybody, a hotline. It is really important to make sure that you are okay from the inside and out.
Yep, I agree. Well said.
Okay, so we will probably have to come back and continue the conversation about returning to fitness, because we kind of really just got like returning to activity. So at some point we'll schedule another one and discuss the returning to fitness postpartum.
Sure.
And obviously Dawn will be a great example, great story of how she's returned to being a triathlete, an Ironman. Dawn, do they call it Ironman or do they say Iron Woman?
No, it's Ironman.
Okay.
Yep.
All right. I'm not either. I don't do any of it, so I don't know.
Kate,
right.
you do triathlons too, right? So
my goal is I don't think I'll ever do the Kona, but that would be amazing.
Oh, that would be, that's the big one. Yep.
You have to like qualify 12 or 17 Ironmans to do it, or the world. Yeah. It's the biggest world championship that you can do, and you run through lava fields. It's no joke.
Yeah.
But yes, I did mostly sprint. I am definitely more of a sprinter athlete. I did triathlons. I did the rock and roll marathon, which 6 months after a knee surgery was not the smartest thing to do. But yes, and I'm still working on returning to activity. I mean, I got pregnant right in the middle of my retraining process, so that, threw a wrench in the mix. But I think it would be great to go back to this and talk about exercise, return to fitness, even exercise during pregnancy too. Because it is not a contraindication to exercise during pregnancy unless you have specific medical conditions. Do not use it as an excuse to do nothing.
That's right.
Okay, so on that, we'll get that rescheduled. That'll come sometime in the future. Kate, somebody wants to get a hold of you right now, has some specific questions. How are they going to do that?
Sure. You can reach me. I'll give you my personal email and my work email, but it's Kate, Kate Nono @gmail.com. or kate.miller@fab-ent.com. You're also more than happy to call me on my phone number. I really don't mind, or text if you feel like that would be better for you, 619-884-8186. I'd be happy to steer you into the direction of increasing your knowledge or just having a great conversation with you. That's fine. I also wrote a course on the physiological changes during pregnancy and postpartum. So did Dr. Duvall, who was on last week. I could steer you that way as well.
Very good. And Don, somebody wants to get a hold of you.
So my email is dstuckey, so DSTUCKEY @HoustonMethodist.org. So be glad to answer any questions.
There we go. All right. And then if you're trying to get a hold of me, just go to sportsmedicinebroadcast.com. And then there will be all sorts of ways to get a hold of me on there. The resources, we mentioned Dr. Sarah Duvall's course on core exercise solutions and things like that. And Kate talked about that a lot last week, so you can listen to the last podcast, or if you're watching live on Facebook, you can check out last week's Facebook Live. But FEIretail.com, if you use the code Aloha25, that's something we're sharing just here with the podcast, so you can save 24% off any of the courses there with FEI?
It's all the equipment. Sorry, it's all of the equipment and courses.
Okay, the equipment and the courses. So FEIretail.com, and you can use the Aloha25, and that's, again, something we're using specifically for the podcast, so check that out. See if you want to get some gear, some courses, something like that. And then there's a February 29th through March 1st 2020 live comprehensive taping course in Round Rock, Texas, and you can use the code SOUTH50 for 50% off all registrations. So again, check that out. And it's a comprehensive taping course here in Round Rock, Texas, and again, that's live, so it's through Strap It, but so
BOC approved.
Yeah, BOC approved. So I have the link there. I'll have it in the show notes. So this is strapit.net/collection/front page. But if you go to sportsmedicinebroadcast.com/pregnancy in athletic training, I'll have a link to those there that we mentioned. And then there's also a discount code for pregnancy postpartum course, which is not pre-approved for BOCs, but it has lots of good handouts and information. And so I'll have a link to that there as well. Without much further ado, I am Jeremy Jackson, host of the Sports Medicine Broadcast. It's been a pleasure learning, sharing, growing with Kate Miller and Don Stuckey as we continue to learn about pregnancy in athletic trainer, as we are specifically focusing on the athletic trainer and not just the patients you treat. Because like they said, you got to do this self-care. You got to take care of yourself, treat yourself, and things like that. So, Kate, thank you very much. Don.
Thank you.
Don, thank you very much. And I know we had to kind of pull a last minute audible. We went from one day to the next day to a different time. So thank you guys for being willing, and everybody checking in live. There was, 10, 20 different people. And like I said, I know, Don, your friend Tana said, she said something like, great job. You're doing a great job, mamas, or something like that. And so she was commenting live in there. So we always love the Facebook Live comments. So for Jeremy, Kate, Don, and the Sports Medicine Broadcast, that is a wrap. Thanks.
Thanks.
All right, the live feeds are done. So
awesome.
We can talk about this for hours.
I know, right? I'm glad there was a guy that asked that question.